estimated 9.5 million, or 14% of premenopausal women in the US, will suffer from a condition known as Hypoactive Sexual Desire Disorder, or HSDD. Despite this, sex and sex issues remain taboo, preventing conversations and solutions from happening, both in public and between intimate partners. At MINDCURE, we're ready to start the conversation around female sexual desire. Introducing the Desire Project, MINDCURE's latest exclusive research project that introduces a new focus in mental health care. We brought together a team of experts in sexual disorders and psychedelics to bring solutions to market using MDMA-assisted psychotherapy for decreased sexual desire in premenopausal women.
I've been working in sexual medicine for 30 years.
My area of expertise is really in the trauma world. So the ways in which sexuality or sexual experiences have the capacity to really break us in pretty deep ways, and then to think about how we put ourselves back together and how that reconstruction, that healing, also involves a return to healthy sexuality. That's what I've been thinking about for 20 years. Anytime we're thinking about sexuality, we're thinking about multiple layers of a human, and they're all working together to create this experience that we call desire.
Desire is really a product of the mind, even if it is a response to stimulation occurring elsewhere. Sexual desire is a construct, really, about interest, although more intense than just interest, in sexual activity that is not specifically event-related. That is, it's not just about when you are participating in sex. So a woman can enjoy thoughts or fantasies about sex, and this is often thought of as spontaneous desire, and that can be associated with motivated sexual behavior, like initiating sexual activity. Sexual desire also includes being motivated to participate in sexual activity, and that can include desire that develops in response to erotic cues or sexual stimulation.
Any experiences of sexual encounters that weren't satisfying or were confusing, or certainly things that were scary or upsetting to us, would inhibit our openness to having those kinds of experiences in a pleasurable, safe way. And so there's a lot that happens just internally that shapes desire.
So most sexual medicine experts use the Biopsychosocial Model to evaluate potential etiologies for diminished or absent sexual desire. So bio is really biology and includes neuroendocrine function, which is really sex hormones and neurotransmitters, medical conditions, menopause, genetic predispositions that set us up to potentially have a greater impact by some of these biological or other mechanisms, and also effects of substances like medications or illicit drugs, especially with chronic use. What generally happens is that those effects can either increase inhibition of sexual desire or decrease the excitation, or both, and that leads to the low sexual desire. So psychology or intrapsychic factors, and those include things like impaired self-image, which is common in women, depression, and fears like of pregnancy or infertility, performance anxiety, or specific partner requests, or if your partner has sexual dysfunction. And then there's interpersonal or relational factors, and that includes the quality of current and past relationships, and that includes a history of sexual trauma. Intervals of abstinence, that is, if you don't have a partner, different things can happen, and various stressors that usually have to do with interactions with others. And finally, biopsychosocial, the sociocultural effects really involve primarily restrictions that women learn from their families about sex, religious prohibitions, and cultural norms and expectations. And it's usually not one of these things that is the cause of low sexual desire in women. It's usually multiple factors.
I think the relationship between low sexual desire and mental health is it's cyclical and it's really intertwined. So anxiety, depression, transitions, trauma, all of those can cause or be part of someone experiencing low sexual desire. But then low sexual desire can certainly increase a level of anxiety, depression, symptoms related to trauma. So you're seeing a real cycle here that people can get stuck in, and they feel kind of increasingly worse as their desire is low, their partner, their significant other feels isolated. Maybe it's causing conflict in the relationship, it's causing self-esteem issues.
But I would say that they are partial solutions at best. There are 2 FDA-approved drugs to treat a loss of sexual desire. The challenge with these drugs is that they really treat the symptoms. They don't actually treat the underlying cause of that loss of sexual desire.
We need more treatments for hypoactive sexual desire disorder. And we really don't have adequate treatments in the context of an individual woman might not respond to any one of the things that we have. Women with distressing low sexual desire, and that's really what we're talking about, often describe feelings like frustration, a sense of loss of a part of themselves, anger, sadness, dissatisfaction, or worry that their partner will cheat or leave, or that it will otherwise upset their relationship. They may also develop avoidance behaviors with their partner to try to reduce the likelihood of being approached for sex and then having to deal with either turning down their partner or having sex out of obligation or out of fear about their partner leaving. And communication tends to break down too. But effective treatment that increases sexual desire usually helps with all of these struggles.
One is the stigma. I think that people assume it's their fault. And there's also this shame or embarrassment around admitting that you don't have desire. Another thing that stops people from getting treatment is just a lack of awareness of the problem and the idea that there may be something that they can do about it.
I am beyond excited, honestly, down to my toes, because I just haven't seen great interventions or ways of engaging this topic that feel really holistic. And I feel like the intervention that MINDCURE is working on is physiological, right? There's some medicine involved that helps to actually change things on a cellular level. But then you've got this tremendous support of a therapeutic team that's helping to address all of the sort of between the ears components of this experience. And so it feels very holistic and very integrated. And I think in particular, MDMA is so powerful in its capacity to help someone reach a new level of empathetic understanding about their own experience. And that is, in my mind, game-changing because it takes people from a place of shame, of hiding, of not enough, of fear, to a place of empathetically exploring their own inner workings, again, with great support, lots of structure. And I just can't think of a better way to do it.
We're not just dealing with the symptoms, we're dealing with the problem itself through the psychotherapy. And I think that's a big advance.
If you want to learn more about the Desire Project and the connection between sexual desire and mental health, visit us at mindcure.com.